Today we're going to talk about leadership, and we're very fortunate to have with us the first 5 staff nurse co-chairs and chairs of our shared governance councils. And we're going to be starting by talking with Tracy Carroll, who was the first staff nurse chair of our professional development council. So tell me a little bit, Tracy, about your work and what you think have been some of the greatest accomplishments of that council to date.
The Professional Development Council is very proud of many of their accomplishments, including Aspire Nurse Leaders Week, the Housewide CN34 meeting, the Nursing Retention Committee, and our Professional Development Journal Club. But I think our biggest accomplishment has been our SAGE project.
What's SAGE?
SAGE stands for Senior and Generational Excellence. It's a project that we put together, an initiative that we did to help recruit and retain experienced professional nurses. Last year, our council identified this as an area of concern for us because we realized that about 45% of our population are SAGE nurses.
And how did you identify the SAGE nurses?
Last October, or October 2008, we were asked to participate in the Mature Nurse Retention Survey. We were very fortunate to work with Dr. Dennis Sherrod and Sue Letvick and be a part of a multi-center research study, which was funded by the Center for American Nurses. And approximately 50% of our nurses participated so that we can find out more about what's important to our SAGE nurses, how we can make it a better environment for them.
Given all that, what's next for SAGE?
We're really focusing on recognition. That's one thing that we know that we can impact positively. Last year at Nursing Staff Recognition Week, we hosted our first annual SAGE Recognition Breakfast. We offered conversation, a chance for SAGE nurses to mingle and socialize with each other. We also offered them a small token of our appreciation to thank them for the expertise that they lend to the hospital.
Tell me a little bit about the token.
We scripted a very nicely written card thanking them for sharing their experience as professional nurses, and gave them a living gift. It was a packet of sage seeds, which we gave as a play on the theme for SAGE, and just thank them for sowing the seeds for younger nurses and helping them grow and develop, and hope that they would do the same with their SAGE.
Well, thank you very much, Tracy. I appreciate that. And now we're going to be talking about diversity, and I'll be talking with Angie Ramsey, the first staff nurse chair of our Diversity Council. Angie, tell us about the Diversity Council. What is it exactly that you're trying to accomplish?
It seems really simple. The mission of the Diversity Council is just to create an environment that's more culturally relevant for our colleagues as well as those we serve. But it's actually quite challenging because diversity is more of a process, and it requires a commitment on all of our part to really focus more on commonalities and differences, and to look for opportunities to create, or look for more opportunities to be more accepting and inclusive.
I can see how that would be challenging, so how have you pursued that mission?
Some of the things we've done is we've sponsored the annual multicultural fair. We've also partnered with the UNC School of Nursing to bring in the annual visiting nurse scholar and make that available to our nurses for continuing ed credits. We did an event that we sponsored and hosted for local Boy Scouts in the area so that we could try to change the perception of men in nursing. And then we also had our very first diversity conference back in the fall that we were very proud of.
Oh, the Boy Scout thing sounds fun. What did you do exactly?
It was a lot of fun. We all worked together to plan it, but it was mostly the guys in our council that put it together. It was really nice to see them get excited about it. And so they brought the Boy Scouts in, and they were able to do an educational piece that would help them to earn a badge. And then we did a tour of the hospital and just showed them some of the different environments that you can work in. And of course, their favorite was to be able to go and visit the air care department and see the helicopter. And they had a lot of fun with that. They actually got to see, they had a call at the time and actually got to see the helicopter take off. So I think that was kind of the highlight of their day.
So what does being part of shared governance mean to you?
Choosing to be a part of shared governance is probably one of the best decisions I've made as a nurse. It's given me an opportunity to interact with different nurses and nursing leaders throughout the hospital. And it's given me an opportunity to see firsthand some of the awesome things that nurses are doing, as well as the commitment that our organization has to supporting those nurses.
So in your experience, what do you think is the single greatest accomplishment of shared governance at UNC Hospitals?
So I think really it's just that it's empowered our nurses at the unit level, and it's given us all a voice. It's made decision making more horizontal instead of vertical. It's given us an opportunity to give our feedback and make suggestions about the decisions are made about the way that we provide care.
Where do you get an opportunity to make those recommendations? How does that work?
Well, questions are supposed to be filtered back and forth from the different councils to the staff members. And then as chairs of the different councils, we also go to the executive council where we're there with, of course, yourself and other directors and leaders in the hospital. And you know, as a staff nurse, I was quite surprised when I first became a part of that process because on numerous occasions, you know, we were actually asked for our input, and it seemed to be very important to our organization that we were able to give our opinion about things that had to do with the way that we carry out.
Well, who better than the people who do the work? Thank you very much, Angie. It's great to talk with Krista Seaman, the first staff nurse chair of our Nursing Professional Practice Council. And Krista, I understand that your council has developed a professional nursing practice model. Can you tell me about that?
Yes, the professional nursing practice model is a system that supports nurses in their care delivery and the practice in which they deliver that care. It's made up of 5 elements, the top being the patient care delivery system, and it's based on relationship-based care. Then they have the compensation and rewards. They have management and leadership. We have professional relationships and professional nursing values.
What are some of the practical improvements that have come about as a result of the work of the Practice Council?
The Practice Council implemented patient hourly rounds at the beginning of our existence. We also implemented IV tubing change days on Wednesdays and Saturdays. The idea was that if we all knew when we were changing the IV tubing, it wouldn't be forgotten, and we would all know when it was last changed when we transfer patients.
Has hourly rounds made a difference for our patients?
We think so. We think that there are a decrease in call bell usage on the units that we have done logs of call bells. We also think that this has been an increase in patients seeing their nurses and being able to have the nurses structure their time so that they can decide what they were going to do each time they enter the room. So they come in and ask, is there anything else I can get for you? And say, I'm going to be back at 2. And then they can leave and they know that they have several minutes that they can do something else before coming back.
It sounds like a big practice change, and instead of waiting for the patient to put on a call bell and have a more urgent need, nurses are proactively going out to see their patients and anticipating needs, and I could see how I would like that much better as a patient. Thank you very much, Krista.